Since our last update, I am very pleased to see that recoveries have now surpassed the 10,300 mark. I'm sure every one of them has a story to tell. Currently, 66 people are in hospital, including 14 in intensive care. Sadly, I must report 5 additional deaths over the weekend, including 2 at Good Samaritan Southgate Care Centre. One of these was reported by the facility on Friday. The lab has completed more than 26,000 tests since Friday, meaning that we now have completed more than 770,000 tests. We identified 108 new cases on Friday, 101 on Saturday, and 48 on Sunday. There are now more than 1,090 active cases in the province. This is a slight reduction from last week, but we continue to identify a significant number of cases. There is some irony in the fact that my cautious optimism last week was followed by 3 days with new case counts over 100. It is a reminder that COVID continues to be with us, and we cannot turn our backs on this virus. As I said, unfortunately, I am reporting 5 additional deaths today, and my heartfelt condolences go out to everyone who has lost a loved one to COVID-19 or any other cause during this pandemic. I know there have been some questions raised about staffing in place at the Good Samaritan Southgate facility. Managing an outbreak requires significant staffing expertise. It is essential that sufficient staff be in place to support residents with all their care needs and to limit the spread of COVID-19. This is a crucial part of containing any outbreak. After staffing shortages were identified as a possible risk to residents at this facility in late July, as a last resort, an exemption was granted to the single site rule to allow additional staff to support the Southgate Care Centre. I do not make exemptions lightly, but I also need to ensure that residents get the care they need and that it's done in a way that does not put others at risk. This exemption allowed local health officials to address gaps in staffing and help mitigate the spread of the virus. Regular staff of the facility are not working in any other places, and the majority of redeployed staff working at the Good Samaritan are also not currently working at any other facilities. All staff must comply with strict precautions to prevent the spread of the virus outside the facility. This is a serious situation. AHS is working closely with Good Samaritan, and they continue to do everything possible to protect the health of all involved. There have been no new cases identified at this site since August 2nd. Another location we have been asked about is the Bright Path Richmond Care Centre, Child Care Centre in Calgary, where I can confirm that 2 cases have been identified. As with all cases, local health officials have isolated those involved and are conducting contact tracing. Anyone at risk is being contacted. Testing is being offered to all staff and attendees of this childcare centre. These are proven processes being implemented to limit the spread and protect the public's health. The centre was not required to close, but the operator has chosen to do so voluntarily. Another question that I've heard is, why does it take so long to get test results? I understand this concern. I share it. Currently, the average turnaround time for a positive test result to notification is 2 days, and this is too long. We have put some measures in place and are working on more to reduce this wait time and to speed up other components of the testing process in the coming weeks. In the meantime, if you are feeling ill and have been tested, please stay home and away from others in your household or cohort until your test result arrives. Speaking of cohorts, another question I've gotten is whether families should restrict their cohorts once children return to school. Ultimately, there is no single answer to this question. We do know that the more people you come in contact with, the greater your risk of exposure. Parents, guardians, and family members should look at their cohorts and assess if they are comfortable with the current size or if they need to shrink it as school begins. This is a decision that each household must make for themselves. If you are in doubt, I would recommend considering shrinking your cohort for the first few weeks of school and then reassessing once the routines of school have been established. Another question is whether COVID-19 can be passed through breastfeeding. I'm happy to say that there have been no documented cases of transmission through breast milk or breastfeeding to date. However, if a mother has COVID-19 and is infectious, precautions can be taken, such as having the mother wear a mask to minimize the risk of transmission during the close contact between mother and child during breastfeeding. The final question I want to address today is how to store and clean a cloth mask. I am recommending that you store clean masks in a sealed and clean storage bag in a dry area. If a cloth mask is used only briefly, if it is not damp or soiled, and if it is removed with clean hands, it can be stored in a clean, breathable container and used again by the same wearer. If the mask becomes damp or soiled, it should be put into a separate breathable bag and taken home for washing. When it comes time to clean them, empty the bags into the washing machine. Consider using a bag that can also be washed at the same time. Generally speaking, warm water is better, but follow whatever directions are recommended for washing your mask's material. You can launder with other items and dry thoroughly. Certainly aware that there are many people who are looking forward to the fall and have lots of questions. Of course, with school being closed since March, many of us haven't had our children in school. And with the exception of some summer school experiences, most children are looking forward to this again with a mix of apprehension and excitement is sort of what I've heard that mix is. I think that the important thing as we plan for that back to school is to know that we continue to watch very closely the literature, the evidence around schools. You've mentioned specifically the infrastructure and ventilation. We know that improved ventilation is something that does reduce the risk of COVID-19. And so I think those are questions that each individual school board, as they look at their schools, as they look at the infrastructure, are needing to consider what their options are. You've asked about the lunchtime process. And again, it's not my area of expertise to look at very specific school protocols. So we have provided the general direction with respect to what's expected in terms of managing students. There's some different options that can be considered, such as staggering break times for different groups, perhaps having students eat in classrooms instead of a common area. But ultimately, those are the details that each school board and each school have the time now to work through what they're going to do within their setting and their specific context to make sure that the students are being advised on how to keep themselves as safe as possible. So again, it will be different depending on each individual school, and some of those options are what we've included in the back to school guidelines.